Hey, it's Dad. I'll let you know in a couple weeks because I finally signed up for therapy. Not that I needed it. Ha! Anyways, I don't know. Like, it's hard because my older kids, they both my daughters did some therapy for a little while, and I know that one of them would say that, like, I don't know, I already talked about my stuff. What else do I talk about? I don't know. So I don't know either, right? It's like, okay, I discussed my issues. Where are we at? What are we gonna do now? You know, like for me, I'm older. Well, I'm assuming I'm older, so I can talk for probably another 20 years and never run out of anything. But yeah, I don't know. Here's the thing. So if you feel like you've plateaued and there's nothing more that this therapist is doing for you, or you just have nothing else to tell them, or the things they're telling back to you isn't working, or it's just the same stuff, you can see somebody else. Okay? That's okay. There's nothing wrong with it. There's no hard feelings. You know, as long as they're within your same insurance provider or whatever, however's being paid, you can go with somebody else. Like, I legitimately am finally going to talk to somebody. As you guys know, I've been on medication for my anxiety, and which just started a couple years ago. So I've been really hesitant about talking to somebody, even though I tell you guys to talk to people all the time. I'm stubborn. I know. I don't listen to my own advice. But I went on Psychology World, and you can go on there and it'll show you like all the different psychologists in your area, all the different therapists, counselors, what insurance they take, if they take your insurance or not. And it's a real easy way to you get a little bio on them so you can kind of figure out who's who. And that's what I did. And it was kind of frustrating at first. I'm like, oh, they're testing me, because I think the first three I picked, I sent them a note, and it's like, oh, we're not available. And it's like, okay, but on Psychology World, it says that you're taking new patients. But that's okay. It's okay. I need to do this. I need to give it a shot to see. My biggest problem, my biggest issue is, I think, just because I know what sets off my anxiety, just because I think I know the reason for my anxiety, I feel like I don't need to talk to anybody. What I don't have, though, is I don't have all the proper tools in place to kind of help me get back to where I was at prior to the anxiety, which is my goal, right? I don't want to be like this. It's hard. It's crippling at times. It's scary. It's horrible for my family members, for you guys that have dealt with anxiety or depression for your whole lives or for years. I got mad respect, because I have no idea how you do it, for how you just keep going. You know, like for me, I'm just like I was paralyzed at first because I thought I was having a freaking cardiac event, and I'm like, what is going on with me? But the RT in me, I'm like, okay, these none of these are the proper symptoms. Like, what is going on with me? I had no idea. Anyways, I've managed to talk about myself like I always do. So yeah, I'm not this Wednesday, but next Wednesday, not this Wednesday, next Wednesday, we'll do our first telehealth. And I'll try to make a video afterwards and kind of let you guys know how it's going or how it went. And then, you know what? I'm going to tell you a little bit of stories of some, matter of fact, I'll probably make another video today about an issue I had with a psychiatrist when I got injured really bad. And and this will kind of give you an insight to why I have my reservations, but I know that I need something extra. There's something there. There's a missing link. There's something that I just can't do to fix all this. So I'm going to outside help. Anyways, back to you. I'm so sorry. I do this for a reason. It's not because I'm narcissistic, which maybe I am. I don't know. It's because, and maybe I'll find out soon. But it's because I want you guys to know that what you're telling me, about 98% of it I can relate to. I've been through it. I'm going through it. Something. And that's the only reason that the conversation turns to me when I don't really mean it to. It's just I'm trying to let you guys know that I understand to a point. Okay? So, again, if you think you've just hit a plateau and the therapy is not going anywhere anymore, then talk to somebody. If you have to talk to your parents, or if you're old enough to just do it yourself, switch, find another therapist. Maybe a new therapist will kind of give you more insight, fresh eyes on what's going on. Anyways, that's my recommendation. That's what I would do personally. You do what you need to do, but don't give up on the therapy, okay? I know everything I just said. I heard it, but don't stop the therapy, okay? Because something else might come up, or something else might be triggered, and you already have it in place. So I wouldn't stop. Maybe switch therapists, something like that, but please continue to go, all right? Anyways, I love you. I'm proud of you.